Well, we're still in the holidays, aren't we? It's a festive time. Happy holidays to all of you. I'm your host, Gregory Bator, and this is Graceful Aging. Today, I've asked Diane Hischke of Serving Seniors and Janice Roble of Optimal Care to come back because I had a lot more questions that I wanted to ask of them concerning seniors during the holidays, both a joyful time and a stressful time. And for you family members, I have a lot of questions for these two women to help you help mom or dad or that older adult who is special in your life. So stick with us. This is the holiday show of Graceful Aging. Well, thank you for joining us during your busy holiday time. We've got two very experienced, very knowledgeable women, as I mentioned in the opening. We've got Janice Roble. Thank you, Janice, for coming back. I appreciate it. And Diane Hischke, thank you again for being with us. So we talked last time about the holidays and how it can bring stress on for a senior. And I thought today we would cover something that every family probably goes through. You know, we were talking before that here come the holidays and here come the relatives from out of town, and they may not have seen grandma or grandpa or mom or dad for many months, maybe sometimes years. Do you deal with a lot of calls of family members seeing mom or dad for the first time during the holidays? Janice?
Yeah, a lot of family that lives out of town, when they come in and they see mom or dad, many times they're surprised if they're with the health condition, if their health has decompensated. A lot of times they're surprised at memory issues.
What did you say?
There you go. I'll be getting a call from your family
Right.
now. And they're surprised that they may look and notice, wow, mom's not taking her medications the right way. Oh, the laundry's piled up. She's not able to do that anymore. They come in and they realize maybe there needs to be more help around here, and they reevaluate what needs to be done. Sometimes when family comes in, they start dropping hints that maybe you should not be living here anymore. Maybe you need to move in with us or move into an assisted living. There's a lot of things that go on during the holidays where, you know, during the rest of the year they slide, but at the holidays they're face to face with them.
You let them all come to the surface, or how do you deal with them at this time?
You know, my advice or encouragement, you know, to siblings, you know, would be to, you know, think about it before you say anything, you know, or count to 10. Too often we do, you know, jump to conclusions. It's not going to hurt anything to think about it a bit and make sure that you say whatever it is that you feel you need to say in the best way possible. You know, it's so often not what we say, but the way we say it that makes the difference in how it's received.
Are the holidays a good time to evaluate mom and dad? Or grandma and grandpa, whoever the older person is?
It's a really good time to evaluate them. And I think that people, if they're afraid to say something, to say, you know, mom, you really do need some more help, you're not helping them by not saying it. To let them know, you know, we're here for you, we can help you find help. And make some suggestions. Maybe the neighbor can check in on you, or you're having some trouble doing your grocery shopping. Let me see what's available out there. Maybe there's Meals on Wheels for you. A lot of times a big issue when people come in for the holiday is they realize maybe mom and dad shouldn't be driving anymore, and that's a huge decision.
That's a big topic.
So a lot of things come up, and yes, they should talk to their parents about it, but it's a very touchy subject.
And if I'm mom or dad or the older person, how am I reacting to these kids coming in from out of town? What's the senior going through at that time?
Well, they're probably a little fearful that something is going to be pushed upon them that they don't want. You know, every senior wants to be as independent as possible for as long as possible. And again, it's putting yourself in their shoes and thinking, you know, how would you want to be approached if you were on the receiving end of this. I think timing is so important. You don't want to start a discussion about, you know, maybe what mom or dad needs as far as help goes at the end of a hectic day or in the middle of a hectic day with a lot of people around.
Oh, but you're fed up with it. You've seen it all. You've got to get it out. So you're
Yeah,
not
but do you want to
necessarily-
be successful or not?
Good.
You know, my goal is that if you're going to talk with your mom or dad about issues like that, you want to do it at the best time possible, in the best way possible. I always recommend to families that if there's more than one sibling or more than one family member who's concerned about mom or dad, to have those family members meet first and talk about, you know, what they're seeing and why are they concerned and what do they think is most problematic, so that then hopefully they'll choose, you know, one or two people to sit down and actually talk with mom or dad. And those one or two people will know, you know, what are the highest priority things that we want to try to address with mom or dad.
You raised a good point in terms of the family member should maybe have a meeting before and talk. And with email and phones the way they are, should family members before the holidays maybe have a conversation about what maybe they're going to see or look for and collectively what they're going to do?
I think that's a good idea, and it can prepare the out-of-town family member for what to expect. If somebody's had a decline in health, they can let their sibling know. You may realize that mom might need help doing X, Y, Z. Another thing would be if the family members can talk ahead of time, like you said, by email. It may be a good time to let the out-of-town family members know, I could use your help with whatever it may be. It may be that, could you maybe look into managing mom's finances, setting up her bills online for her because it's getting more difficult for her to pay them. If they talk together, they can then divvy up the care. Sometimes it's overwhelming for the caregiver that's at home because they're responsible for everything, transporting to the doctor's appointments, purchasing mom's gifts for the holidays.
Those could be good Christmas gifts that people could give as well, I would think.
Yes.
Yeah.
Yeah, so there's a lot that the in-town person is doing that they can
Supplement.
yeah, let the out-of-towners know that this is where we could use some help.
I want you to put your investigative hats on now for family members. So if I'm doing, say, appropriate snooping to see mom and dad's condition, what am I looking for? In the house, with them physically, with them mentally? What are some warning signs or signals that family members could look for during the holidays? Janice?
One of the things you could do is checking their medications. Make sure the medications are being taken appropriately. A lot of seniors use pill boxes, and you can go there on Wednesday, let's say, and you see, Tuesday's pills, most of them weren't taken. You can check in the refrigerator and see, wow, there really isn't much food in here. Not because they couldn't necessarily afford it, but they can't find a way to get to the grocery, or they can't carry the groceries in. So you can check in the refrigerator.
What about mail and things that come to the house?
Yeah, that's actually what was coming to my mind. Noticing if there are bills laying around that haven't been paid, if you're able to access their checkbook, are they keeping their checkbook up the way they used to? Because, you know, those are higher level skills that someone who is experiencing dementia are likely to lose before the skills of, you know, being able to fix themselves breakfast.
Would it be a good thing to check in with the neighbors as well, or the usual friends that mom and dad had?
Yeah, you'll get a lot of input from the neighbors and their friends. They can let you know, have they been able to get to the end of the driveway to pull in their garbage cans? Just simple things like that. Neighbors can be incredibly helpful. I've had a few occasions where they'll have, a resident will have a signal with a neighbor where they open their blinds to just let them know they're okay in their morning. So, and the neighbor can say, you know, we've seen ambulances out here, because many times they don't tell the kids. I've had patients who've gone to the hospital and not told their kids because they don't want their kids to worry about them. So you can really get a lot of information from their friends and neighbors.
So being set up maybe with a little holiday gift to carry over for the neighbors on behalf of mom or dad
There you go.
can get a lot more than a smile and a thank you. What about the house itself, the condition of the house? What should I be looking for?
I probably, you know, see older adults starting to neglect themselves, that is more noticeable maybe than the house being cluttered and
how so?
unclean. They sometimes will stop getting into the shower or bathtub because they're fearful of falling, or with dementia, sometimes just, the fear of being in a shower or a tub. You can notice, are they still using that shower or tub, or do they have clothes hanging in there, or can you tell that it's not been used in a long, long time? Soiled clothing, or not changing their clothing on a daily basis or as often as they used to in the past. Those are also common signs that maybe there's a decline.
Those are good investigative questions and areas we can look at. We're going to take a short break right now and talk about how we bring these topics up to mom and dad in an effective way. So stay with us. Well, our graceful aging moment for today's show is a question that may be on your mind. There's a term that's been used, and you should know the answer, but you probably don't. The question is, that I'm going to pose to Janice. Janice, what is a geriatric social worker? I know our viewers have heard that term maybe, and I think it's important that they know the answer. Could you tell them?
Sure. Geriatric social workers usually work as part of a team from a home health care agency. Usually what happens is a doctor will order a home health care agency out. They'll send a nurse, they may send a physical therapist, and then I'm part of the team too, which is a geriatric social worker. My job is to make sure that seniors are aware of the community resources that are out there for them and also help them with long-term planning. Some real simple things. I might be able to help someone with resources like Meals on Wheels or transportation if they're not driving anymore, hiring private duty help. A lot of seniors aren't aware of programs at their local Department of Human Services. They might be entitled to a chore grant where the government will actually pay for somebody to come out to assist you in your home. Lots of seniors are not aware of veterans benefits. The VA can help pay for assisted livings for many, many of our veterans. The VA also helps with things like medications, paying for them. Geriatric social workers help you be aware of the resources that are out there. In addition, we help with long-term planning, things like housing. Some seniors are ready to downsize. They're interested in senior housing or assisted living. Some family members also want information on nursing centers. They want to know how to financially protect their assets so all of mom's money doesn't go to a nursing home. So these are some of the things that geriatric social workers can help out with.
Oh, that sounds terrific. Well, now you know the answer. And that's our graceful aging moment for today. Well, welcome back. We're with Janice Roble and Diane Hischke, and we're talking about the holidays, DAZE, and the stress and how we can deal with it as family members with seniors, and seniors, how you can deal with it yourself. So let's take a look at this tough issue. So here I've come in for the holidays. I've got brother and sister. I've gone to the neighbors and I've gotten input there. I've sort of checked around politely around the house and I've noticed the shower isn't being used, or I've noticed the medications weren't taken on Tuesday. I've got indicia of maybe some issues relating to the senior person living in their own home. Do we bring it up to them, and how do we bring it up? That's a pretty delicate area, isn't it? Mm-hmm. Do family members make mistakes? And let's talk about the mistakes. What mistakes do family members make in bringing up, you've got to change, Mom, we've got to move you, or what is it? Well, open question.
Well, some of the seniors aren't ready to hear that. They don't want to hear that you can't do it everything, or that you need help, or that the big one for me is when children tell their parents they need to hire help. Seniors,
I've done that all my life.
Well, and seniors will say, I don't want to spend the money. They're saving it all for their kids or their grandchildren. Right. And they have a hard time getting through the hoop of, yes, I do need help. And when kids tell them that and they haven't realized it on their own, it's hard for them.
So how do you broach that? How do you get to that
I think you got to stick
spot?
your foot in the door a little bit and just say, you know, we're going to hire somebody to mow your lawn for you. Grandma, we don't want you out there pushing the mower anymore. We are going to shovel the snow for you. Grandma, how about if somebody comes by just one day a week and does a little housekeeping just to put your foot in the door? And sometimes they do realize, wow, this is really nice, and they're comfortable with having somebody come in. A lot of seniors are uncomfortable with strangers coming in, even if they're from a licensed and bonded agency. So if you can get your foot in the door and they get used to having that help,
But what are some mistakes? What do families goof up on that say you in your role have to come and clean up after them?
Yeah, I think probably the most frequent mistake I see is the nagging. You know, instead of, you know, sitting down and having a good discussion, it's, Mom, when are you gonna, you know, hire somebody to do the laundry?
I've told you this over and over and over,
Yeah,
this is it.
Yeah,
Not
you know,
good.
again, you know, it's not so much what you say, but how you say it. You need to, you know, preface the discussion with just a statement, some kind of statement, whatever's comfortable to you, expressing your reason for making a suggestion, you know, saying something like, Mom, I really care about you. You've worked so hard your entire life, and I want you to have it easier now. You know, just, it's amazing what a difference that can make in encouraging the mom or dad to hear and to at least be a little bit open to what you're going to say. So prefacing it with your concern and your good intent is important.
So here, Grandma shuttled herself off to the quiet area that we have in the house so that she can have some peace and quiet during the hubbub of the holidays. And here everybody else is at the dining room table talking about the older person at the table, and she can still kind of hear us. Is it, do we involve the older person with the change, and if so, how much?
First, I'm wondering if Grandma really can hear because she was refusing to wear her hearing aids. That's a huge issue, but yes, you can't make the decision for them unless there is dementia. I always say, you know, you can't force somebody to go to an assisted living. You can't force them to go leave their house unless there's a safety issue, unless they have dementia and they've decompensated that bad. I say take it with baby steps of let them know, let's try this. Let's get a little bit of help for you. But yes, definitely involve them because they'll resent it and it'll be a setup for failure.
And here's brother or brother-in-law from out of state, and he's always been the vocal one, the assertive one, and he just takes it upon himself and sits down with mom or dad and says, this is what we're going to do. Do you go the single route like that? How does a family come together, and what do you suggest, you know, with all the house full of relatives, how did they actually make the intervention? One spokesperson, a group meeting, what do you recommend?
Yeah, I think one or two spokespeople generally is most successful. And again, I think it's important for the involved family members to sit down by themselves and talk about their concerns and identify, prioritize, you know, what are they most concerned about? Is it mom falling and not being able to get up or get to the phone and laying there for 2 days? You know, is that the biggest concern? And if so, that's where you start, is with the emergency alert pendant. Another just important point that I wanted to throw in that I always use when trying to identify where to start or how to get my foot in the door, and that is trying to identify by talking with the senior and with the family something that maybe they have some awareness that they may need some help, need or want some help with, and start there. It may not be your highest priority item, but it's a place to start. If you're able to wait on that higher priority item. But again, talking with the senior and identifying if there's any area in which they might have some interest or awareness that they might have a need for help.
And what's their fear? Is their fear that they're going to lose their house or lose a privilege? Is that really what's in the senior's
They're
mind?
afraid that if they accept even this little bit of help, that the next thing they know, they're going to be pushed out of their house. It's to the nursing home. You accept a little bit of help, and then the next thing you know, you're being pushed out of your house.
And that doesn't have to be.
No, absolutely not. In fact, your intent is the other, the other solution. Typically, you want to help your mom or dad to stay in their house as long as possible.
Now, through the holidays, are there resources that family members can contact, like the two of you or similar people like yourselves? Are you busy during the holidays fielding these types of questions? And what do you do? What resource do you provide to families during these times?
I think one of the best resources is your area agency on aging. Every community has one of those. It was formed by they were formed by the Older Americans Act in 1974. They have an information and referral service. They probably won't be open Christmas Day, but they'll be open probably till at least noon on Christmas Eve, and around all of those, around the main holidays. That's an excellent resource.
Area Agency on Aging. They're in every community mandated by federal law, so you can always find that phone number very easily, and operators would have it if you called. What else?
Or they could call 800-852-7795. That's Area Agency on Aging.
Okay.
So that's a fabulous resource. When family comes in for the holiday, some other resources to look at is if they're not able to get meals for themselves anymore. Maybe you should think about getting Meals on Wheels. When you come in for the holiday, if you notice some of the things we've talked about, like maybe grandma or mom needs help with laundry or errands, things like that, great resource is hiring somebody, hiring a private duty agency. There's dozens and dozens of them in our community that you can hire that can do anything from helping mom bathe or dad do grocery shopping to housekeeping to driving them to medical appointments. And then the third thing we mentioned before is a lifeline. A lot of seniors, what I say is the three main things: get a lifeline, make sure you have meals, get help if you need it, like a private duty agency. And those are three simple things you can set up for somebody during the holiday seasons.
Well, I have so many more questions, like dealing with the protective spouse who protects the person. They don't want to move themselves, to all sorts of other things, but tough issues which form the body of the professional work that the two of you do. So I would imagine that you're called in on a variety of difficult, complex problems and issues that families have let build up over some period of time.
Yes, if it's easy, you don't need a professional geriatric care manager, but we're the professional that can help families that are in conflict when they can't come to a decision as to what the plan could be, or if there is no local family or maybe one designated child for whom all of this caregiving and all of this decision making is burdensome, then involving or partnering with a professional geriatric care manager can be very helpful.
Oh, very good points from both of you. Happy holidays, Diane Hischke.
Thank you. Happy
holidays, Janice. And I've got a special surprise for you in our viewing audience, and it's right around the corner. Stick with us. Well, we're delighted today to close the show with a little holiday song. And here we have our soloist from the Marian Melodies, Mary Pickens, accompanied by Christine Gaiman. Take it away, Mary.
Present is here today. Bring the fates allow. But till then, we'll have to muddle through somehow. So have yourself a merry little Christmas now. Da da da, da da da, da 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 da, da da da, da da da, da 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 da, da da da, and have yourself a merry little Christmas now.
Well, that was wonderful, Mary. Thank you so much.
Thank you.
Thanks for being on Graceful Aging. We'll say happy holidays to everyone. Thanks for joining us on today's show, and the best to you and your family. Mary Pickens from the Marian Melodies, and we'll close it from here. Take care.
Now, da da da, da da da, da 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 da, da da da, da da da, da 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 da, da da, and have yourself a merry little Christmas now.